My next guest, Dr. Jaewon Ryu, is the president and CEO of Geisinger, one of the nation's largest integrated health service organizations. Geisinger, which operates in Pennsylvania and New Jersey, had to find innovative ways to respond to the disruption caused by the pandemic. Hello, Dr. Ryu. Thanks so much
how are you?
Great. Thanks so much for joining us. So one of the reasons I want to talk to you is because there are a lot of healthcare systems and whatnot, but one of the things I'm very interested in is how are we innovating right now? What is new and different that we're doing? And my understanding is you're using artificial intelligence to help improve how we handle the crisis we're in today.
Well, we've been pretty far out ahead on that journey, actually, even prior to COVID. And I think COVID has magnified or intensified some of these capabilities and the importance they play in being able to prioritize who really needs to be seen and which kinds of care gaps need to be addressed first. I think the effort that you may be alluding to is a partnership we have with Stanson Health, where it essentially looks through the electronic medical record, looking for signs and evidence that may suggest that there's symptomatology where certain patients need to be tested because they have a higher risk or a higher potential for having the virus. And so that's just one example of how we're going about trying to prioritize the efforts at a time when certainly, prioritizing resources and focusing which kinds of patients you want to pay attention to is mattering more now than ever before.
Let me kind of ask you an unfair question. I want to understand, you're a big player out there, and you understand, you see what's going well, you see what's not going well, you see what the federal government is doing and not doing, you see where the vaccines are coming, you see what's happening in terms of healthcare provision. What don't we have today in our civic system, if you will, as we debate school reopenings, for instance? What do we not have out there that you think we desperately must have?
Well, I think some of the learnings that we've had over these last few months is that as much as this has been a clinical battle, it's been a battle of communication, education, and just getting word out to the communities. We've been an organization that has long been known for prevention and health, partly due to the fact that we own our own insurance company as well. And so we've been aligned around care models that prevent and keep people healthy and out of the ERs and hospitals. I think that capability has transferred well to the COVID environment, but certainly it's strapped all of the resources. And if I had to make some observations, I think the public health infrastructure and how we're really accustomed to thinking upstream and going upstream from the clinics and the hospital environments, I think that's a mindset that's probably a little less developed than we'd like it to be. If you're looking at the healthcare industry at large. I think the other is just, and we recently wrote an article about this, but just the fragility of fee-for-service payment. You've seen health systems just being crippled financially as a result of this, simply because they've had to postpone the non-urgent, non-emergent services. And I think, if anything, it's a good reinforcement of the fact that value-based or population-based payments really have greater stability, where it allows health systems to focus specifically on prevention and wellness around the community, which is obviously important in times like these.
You have some interesting programs that deal with some of the complexities of dealing with elder care, your 65 Forward program, looking at how you deliver healthcare services at home. I know folks that are in their 80s right now have healthcare issues, and they're very afraid to go to a hospital or an urgent care center because of the possible proximity to others infected with the virus. Tell us about those programs and how important they are to potentially be replicated elsewhere in the country.
Yeah, so we've been very fortunate because we've taken care into the home even prior to COVID. And we've had programs such as, we get really creative with names, but one of the programs is called Geisinger at Home. And it focuses on the sickest 3 to 5% of our patient population and actually takes IVs, nebulizers, treatments and therapies, as well as providers, directly into the home to help manage those chronic diseases. And by virtue of doing that, we're able to see decreases in the rate of ER and hospital admission rates by up to 30 or 40% at a time. That's been a great capability to rely on in a time like this when exactly those kinds of patients with the chronic disease, the sickest 3 to 5%, they're the folks that should not be coming in if there's any way to avoid it. And being able to render that care and be able to continue with that in the home environment has been invaluable. I think the other one I would point out is our mail order pharmacy program. We launched this a couple years ago, but what better way than to be able to deliver medications for chronic diseases to someone's doorstep so that they don't have to put on a mask, get in the car, worry about social distancing and so forth in a retail pharmacy environment. And we've seen that even before COVID, when we use that mail order pharmacy, the patient medication adherence rate is 35 to 40% higher than what it would be. These are instrumental programs, and when you're able to take care out of the facility environment and deliver them and make health easier by pushing them closer to the home, closer to the community, we know that everybody can win.
One of the factors that we have not really figured out yet when there is a vaccine or therapeutics that become available is how we're going to get it to everybody who needs it, how we're going to deal with affordability and access. A lot of that is still out there. Dr. Robert Redfield, whom I've interviewed in the past, and we'll have him on the program later today, said, look, we're going to have to go and find homeless people who are infected, and we're going to have to find a place to put them in shelters and isolate them and treat them. And we're going to have to do that. I mean, he was very firm on that. But as a healthcare provider, how prepared are you and your colleagues to sort of deal with the fact that there will be folks with very little resources and vulnerable communities that need some help affording and definitely need access to these drugs? I mean, so I'm just interested, as someone in the system, how do you deal with that?
Well, I think this is where our strong community roots, I mean, for over 105 years, Geisinger has been born out of the community and being in an environment that's not the big city. We have smaller cities and large swaths of our geography that are rural. We're very closely tied to the community. And if there's one thing we've learned in this pandemic, it's that what affects anybody in that community affects all of us. We truly are all in this together. And if you look at issues like in the nursing homes, for example, any little outbreak there, very quickly it became apparent to us that that became our problem as well, even though those are not our environments. And so I think we would take a similar approach in the case of vaccines and treatments as they become available. That we would make sure to take a similar approach where anything that we can do to get those treatments out, regardless of who someone may be, if we can get more people protected in our communities, we know that we will all benefit.
Let me just ask you a final question. I know that you're a healthcare provider. You're not necessarily in our world here in the political world, but there's a political storm brewing. Randy Weingarten of the American Federation of Teachers called it a train wreck coming on the issue of school openings and what public health guidelines and support services and researches go to the schools. And I guess my question is less about the schools and are you worried that the surges that Dr. Fauci just talked about a few minutes ago, you're in New Jersey and Pennsylvania, are you worried that that's our future, or are you confident in the areas you're working that you're seeing responsible behavior from folks and stakeholders and that this will come down? I'd just love to get your take.
I think it's a mixed bag, to be honest with you. I think I'm optimistic because we've learned a lot. If you think about where we were at the beginning of March with this, we're in a very different place now, whether it's PPE or testing or understanding more about the virus and its biology. At the same time, I am concerned, and I think many of us in healthcare are concerned because, as I mentioned before, the battle is not just clinical. It is communication. It is a battle around educating those in the community and making sure that they're staying ever vigilant around things like masking, social distancing, hand hygiene, and so forth. I think if we do those things, we'll be much better positioned.
Well, Jaewon Ryu of Geisinger, thank you so much for sharing your insights with us and being with us today. Really, really appreciate it. Thank you.
Thank you so much.